And in medical schools, and there are a lot of doctors here, as you know, your heroes are the internal medicine doctors. They can look at your fingernails and tell you lived in Brazil. They can make all kinds of diagnoses. So I decided to be an internist. What they don't tell you is that the thing you hate in training is called internal medicine clinic. And that's where you sit there and see people coming in with self-destructive, incurable disease who are non-compliant, one after the other. When you get out of training, this is called the practice of internal medicine. You have 9 minutes to see these people, and you can't do a whole lot in 9 minutes except give them medications, and was kind of discouraging. The only good thing about it are the patients, and one in particular, an elderly lady, and elderly is 15 years older than you are at any given time, so she don't listen elderly now. This elderly lady named Betty would come in, she'd put on her gloves and her hat and her girdle and her powder and her pantyhose and come in and see me about once a week because we had good reports. She had osteoporosis, a little hypertension. Mostly she was lonely. And we'd sit there and we would talk, and I would spend some time with her, a little more than 9 minutes because Betty was special. And Betty would tell me things like, you know, I'm practically legally blind. I can barely walk at all. I'm completely deaf without my hearing aid, and even then I can't hear. Thank God I can still drive. A lot of those out there, you don't see them because they're sitting below the dashboard. Usually they only drive at daytime, though. The other thing about Betty was that you would see her, and it would take us, and part of the ritual in internal medicine is you've got to get them undressed and examine them. They expect that. Got to touch them, put the stethoscope on. So we get her undressed. It would take about 20 minutes to get that girdle off and get her in there. And so I would examine Betty, and I get everything together and get her all packed up. We get her redressed again. I would have to help with that process. We get her finally going out the door, and she's going out the door. Does it mean anything that there's blood in your stool? We'll talk about that next week. Here, take these little cards home and bring them back later. In the ER, it's what I call, and how many people here have been in the ER? If you haven't been, you will be. Your time will come. Hopefully for nothing too serious. I think in this group, I'm not going to see you in room 1. That's the one you don't want to be in. But the ER is kind of like there's a tsunami. It's the trailway station of medicine. When you go, take your reading material and pay attention. There's a lot of drama going on around you if you look around. I was coming to work the other day, and there's a man lying in the hall, an elderly gentleman. And as I come in the door, there's people all over the place. It looks like that scene from Gone with the Wind at the battlefield, the medical thing. People, help me as you come in. And on my scrub suit and my stethoscope. As I come in, he says, "Are you the doctor?" "Well, yes, I am." "Well, I'm in terrible pain. I've been here for hours and hours and hours, and somebody got to wait on me." "Hold on a minute, sir. Concierge. They're coming right away. What does it require to go to the ER? It's pretty strict. We have to be a homo sapien. That's what's required. We have some question about some of the people coming in, but they're mostly homo sapien. There may have been a few Cro-Magnon, we don't know. But they're homo sapien. You don't have to pay. You don't even have to want to come in. They may bring you in whether you want to or not. You're going to be there. You don't have to be nice to me. You can call me names. You can insult me, my family. You can spit on me. You can kick me. You don't have to take the tests I suggest. You don't have to do anything I suggest. And you can sue me. You can even run naked through the ER, which the man did 2 weeks ago, with the Foley catheter in. I was standing there at the door, and being a former football player, I thought, I can tackle this guy. And I remember what Coach Small said. When you tackle him, always put your head in front. Don't do an arm tackle. Head in front. Pull his legs out from under him and bring him down. And as he started running by me with the Foley, I thought, maybe I'm not going to tackle this guy. There must be a grace in there somewhere. I'm not sure what it is. Who comes to the ER? 80% of the ER population are women. Women. Why is that? Because the big dummies don't know enough to come to the ER unless their wives tell them to come or make them come. Married men live for 8 years longer. There's a reason for that. Sir, you have this thing going on your chest. How long has that been there? It's been there a couple of years, I reckon. We put aloe on there, I put bacon grease on it. Well, it's a fungating tumor and it's eating through your chest wall and into your chest cavity and through the bones. Well, let the dog lick it out. I figured it.
It is true.
The other difference in men and women is, cover your ears, girls, our bowel habits. Now, men, the sports section, big deal, sit there. That's why you have hemorrhoids, incidentally, if your mother didn't tell you that already. And they make a big production. And one other thing that men do is they will check the sample. They'll look down there every single time. Am I telling the truth? Not only that, they will check the smear, the specimen. I'm not making this up. Does it do them any good? No. Looks like there's blood in there or something in there that's moving. I don't know. I sure hope it gets better. They'll stay home from the ER with heart attack, stroke, bleeding, you name it. There's only two reasons that men will come to the ER 100% of the time. Only two reasons. I'm going to give you the first one. Something in their eye. If they're on drugs or intoxicated, they may not come from that until the next day. But there's another reason they will come 100% of the time. If you get it right, you get a discount on your next ER visit. Anybody know? Yeah?
Get your thing stuck in the zipper.
That's getting pretty close. It's pretty close. I'll give you half credit on that. If they can't pee, they will come to the ER. That's the only other reason. So once you get through this process, the next thing you go through is a thing called triage. And that's where the nurse takes you in a little room. We call it the demilitarized zone. Because we're going to decide if you're sick enough to be seen yet. So they take you in a little room over here and they ask you my favorite question, what seems to be the problem? It seems like I'm having an elephant on my chest, I can't breathe, and I'm all sweaty and feel like I'm going to pass out and the pain's going to my left arm. Oh, is that right? Well, how long has that been going on? What medicine do you take? And what was your birth weight? And what color was your hair when you were born? And on it goes for about 30 minutes. That doesn't guarantee you're going to get seen at all. That now guarantees that the triage is finished, that you're going to be going to a little room to sit and wait somewhere. But before that, we need you to tell us your height and weight. You guys will enjoy this. For women, we add 15 pounds. Take off 1.5 inches. For men, we take off 2 inches and add 30 pounds. And that's about right. Do you smoke? No, I don't smoke. Did you ever smoke? Yeah, I used to. I quit. When did you quit? 10 years ago. How old are you? 70. Well, then smoking might... No, I quit. It's do you drink alcohol? Only when I can get it. Smoke, tobacco, alcohol? What are you serving? I don't drink alcohol. I never touch this stuff. I drink beer. Only beer. That's the truth. That is all the time that happens. So you get in a room, they give you a little gown. And this is an IQ test we use on patients. The nurse comes in, she puts the gowns around the thing, she says, get completely undressed, put the gown on with the opening to the back. Then she leaves. You sit there and opening to the front, back. If you put the opening to the front, we lower your IQ by 20 points. If you put the opening to the front, we hope you have something to show us. We hope so, because we're going to sure get a look. After you sit there for a while with the little gown, and we know that you get up and look in the drawers. We know you get up and look at the little otoscope thing, and you kind of... We know that some of you put it in your ear and go over to the mirror and try to see in it. We know that. We know all these things. Don't take anything out of there, incidentally. Band-Aids don't need it. What are you doing? Get back on the table. I'll be here in a minute. I'm going to give you a couple of what I call doctor speaks. When the doctor comes in to examine you, they do several things that are kind of strange. One is, when they put the glove on, and it's time for that exam, they do things like make bad jokes. They don't call me the Rear Admiral for nothing. We're going to check your oil. Not mine. The other thing they do is they will, when they're getting ready to do something for you, it's not to you, it feels like to you, but it's for you. They'll tell you, you're going to feel a little pressure now. Now, men know, particularly if they're doing something down here, that little pressure means that you're going to see a searing white light with pain that you have never felt in your life. You're going to sweat, pass out, and see Buddha all at the same time. A little pressure here. It's kind of fun being a doctor. You can use it to your advantage. That guy, that contractor that worked you on the landscaping deal and kept raising the price on it, you go over to him and you say, Blair, did that nasty discharge of yours clear up, or say that at the cocktail party across the room? Remember that test we ran on you? Yeah, I need to talk to you about that. Finally, I'm going to end this because he's giving me that look. I'm going to end this. Just a couple of comments about drugs. The one I like is Viagra. Now, the old guy will ask you, can I, while I'm here, can I get a little Viagra? Behind him is the wife going, she grabs you later as you walk by and says, please don't do that. I thought we were through with that. Please don't do that. It also says on there, if you have an erection for more than 2 hours, phone your doctor. Hello? How long? What? Oh, really? Oh, gee. Well, yeah, that is, yeah. You better put Nadine on, yeah. We got to stop it. You're going to get cystitis. There's no question about it. Get a bucket of cold water and put ice in it, and I'm going to give you instructions. A gentleman mentioned the zipper. I've done some TV work, and one of the shows they asked me to do as chief of staff of my hospital was to go on a show called Mansers. The young men around here might know about that. It's a show on Spike TV for young men. It tells you things like how to get out of handcuffs, how to get admitted to the nightclub, and things like that. And the one they gave me was, what do you do when you get your junk caught in a zipper? This is useful information here. You may like this. There's two populations that have that problem. The 2-year-old who forgets to put the horsey back in the barn. He only does it once. Then there is the young man who, under the influence of drugs and alcohol, relieving himself behind the 7-Eleven when the squad car pulls around. When they come in, they all have the same sign. We call it the zipper sign. They come in holding their pants up with one hand, a towel in front of them here, walking like this. Most of them have had their friends who are also under alcohol and drugs attempt to help them with WD-40 and Newton Lowe's pliers. If you remember that ski jacket of yours where you get the zipper caught and you kind of do this, that doesn't work. What you do is look at your zipper right now, and you'll see on top there's a little bar right across there. All you do is cut that bar, pops right open. That's all there is to it. I hope not to see you guys in the ER. I hope to spread the word about this to my fellow doctors. They aren't listening, but I'm going to keep trying. And I hope you stay healthy and don't see me. Thank you.